Hello my dear friends, and welcome back to Dr. Alicia's MedTalk. Today, we're diving into a topic that's quietly affecting millions of older adults, yet remains shockingly underdiscussed. Every year, countless seniors attend health checkups thinking they're taking all the right steps to stay safe and healthy. And while many screenings are truly life-saving, there's a hidden reality most people over 70 are never told. Some of these common checkups may actually lead to more harm than good. In fact, emerging scientific evidence reveals that nearly 37% of routine medical tests in seniors lead to unnecessary treatments, serious complications, and long-term consequences, sometimes even increasing the risk of stroke, surgery, or cancer. And here's the jaw-dropping part: 99% of people over 70 have no idea they're being overtested. That means millions of well-meaning seniors may be stepping into risky medical pipelines, all from tests that were supposed to protect them. One of these very common screenings, the most dangerous on our list, may even be responsible for up to 5% of all cancer cases in the US, a number equal to the cases caused by daily alcohol consumption. But you won't hear this from your doctor during a routine visit, nor will you see it on a billboard outside your local clinic. It's buried deep in the research, and today, we're unearthing it. I'm Dr. Alicia, and in this important video, I'll be exposing the 5 most overused and potentially harmful checkups for seniors over 70. All the information I'll share is backed by real studies, real patients, and real outcomes, and number 2 on this list is going to shock you. But first, I'd love to hear from you. Where are you watching from? How old are you? And have you or someone you love ever regretted getting a medical test or procedure? Do you think older adults are sometimes pushed into testing too much, too soon? Let us know in the comments below. My team and I read and respond to every comment with personalized support and wellness tips just for you. And don't forget to like this video and subscribe to Dr. Alicia's MedTalk for more empowering health content made especially for adults 60 and beyond. Now let's get started with the first checkup and why this seemingly innocent test could quietly unravel your peace of mind. At number 5, we have the bone density scan, also known as the DEXA scan. At first glance, it seems like a harmless and useful test. It's quick, non-invasive, and tells you if your bones are at risk for fractures. But for people over 70, it often creates more fear than benefit. That's because almost every older adult will naturally have lower bone densities, just like wrinkles and gray hair. Some degree of bone loss is part of aging, yet many people are pushed into medications like bisphosphonates, which are meant to strengthen bones but come with serious side effects such as jaw necrosis, where your jawbone actually begins to die, severe acid reflux, and esophageal irritation. What's worse, studies show that these medications barely make a difference in fracture risk for people over 70. One major study found that after 5 years, bisphosphonates reduced fracture risk by a mere 0.3%, while causing far more side effects than benefits. Consider the case of Rose, a 76-year-old piano teacher who was diagnosed with mild osteopenia after a routine DEXA scan. She'd never fallen, never had bone pain, and walked daily. Her doctor still prescribed her bisphosphonates. Within just 3 months, she developed jaw pain so severe that she couldn't play piano, her favorite lifelong activity. When she came to us, we took her off the meds and started her on a holistic plan: weight-bearing exercises, vitamin D supplementation, and a calcium-rich diet with foods like sardines, leafy greens, and almonds. A year later, Rose was performing, again with better balance, stronger legs, and no fractures. Her story is not unique. Research shows that lifestyle changes alone, such as resistance training, balance work, and proper nutrition, can reduce fracture risk by over 20%. So, before you agree to treatment based on a scary scan result, ask yourself, am I falling? Am I in pain? If not, you may not need medication, you may need movement and nutrition instead. Now, let's talk about test number 4, which involves your brain, your memories, and one of the most fear-inducing diagnoses out there: dementia. At number 4, we have the brain MRI for memory loss. When seniors feel more forgetful or misplace names, many doctors respond with an MRI. But here's the uncomfortable truth: most brain MRIs after 70 show changes that are normal for age: tiny white spots, shrinkage, or mild atrophy. However, once a patient hears abnormal MRI, it often triggers panic, fear, and a chain of unnecessary follow-up tests, such as spinal taps, PET scans, or even brain biopsies. A 2021 study of 3,000 MRIs in seniors found that 86% had abnormalities, but only 3% were treatable conditions. That means 97% of patients were frightened and further tested for issues that weren't truly problems. Take George, a 74-year-old engineer, who started forgetting names and was sent for an MRI. The scan showed white matter changes. Convinced he had dementia, George stopped driving and withdrew from friends. But when we gave him a basic memory test, his score was completely normal. We reassured him, encouraged him to focus on hydration, sleep, and brain-boosting games, and, within weeks, his memory stabilized. Unless there are clear neurological symptoms like seizures or sudden personality changes, an MRI is rarely helpful. A simple cognitive test, like the MoCA or MMSE, is often a better and safer first step. It avoids panic, reduces costs, and is more effective at detecting actual memory issues. Now let's move to number 3. The cardiac stress test, often done when seniors report mild fatigue, shortness of breath, or just a general dip in energy. This test, where you're placed on a treadmill to monitor your heart, is designed to catch blockages. But in people over 70, the false positive rate can reach 40%. That means many seniors are told they might have heart disease when they don't, leading to unnecessary angiograms, stents, or even bypass surgery. A landmark 2017 study found that more than half of stents placed in seniors following stress tests had no real benefit. They didn't improve survival or quality of life, but they did increase risks like bleeding, kidney damage from contrast dye, and even heart rhythm problems. Meet Raymond, a 75-year-old postman who felt a little winded on hills. A stress test led to a stent, which led to a contrast dye reaction, which landed him in the hospital for 6 days with kidney issues. Yet his fatigue persisted. It wasn't cardiac at all. He simply needed more hydration, better sleep, and slower meal pacing. For seniors without classic heart symptoms, better options include a resting EKG or calcium scoring test, which are lower risk and more targeted. Now, brace yourself for number 2. Because it's a test almost everyone over 50 has had at least once, the colonoscopy. After age 70, and especially beyond 75, colonoscopies become far riskier. The prep alone, strong laxatives can cause dehydration, dizziness, or kidney strain. And the sedation used during the procedure increases the risk of post-procedure confusion or delirium. A 2019 study in JAMA Internal Medicine analyzed over 1.3 million seniors and found that for every 2 lives saved, 20 people experienced major complications, and many of the polyps removed are slow-growing and harmless. Take Dana, a healthy 73-year-old baker with no GI symptoms and no family history. She was talked into a screening colonoscopy where a small polyp was removed. That night, she experienced abdominal pain and fainted. She was hospitalized for a bowel perforation, lost weight, and her recovery took months. And she'd already had to clean colonoscopies in the past. There was no need for another. The U.S. Preventive Services Task Force recommends stopping routine screening colonoscopies after age 75. If you're still healthy and want to monitor things, consider the FIT test, a stool-based test that's easy, safe, and done at home. Finally, we arrive at the most overused and dangerous checkup of all: full-body CT scans. These are often part of executive checkup packages or sold as premium preventive services. But what most seniors don't know is that these scans expose the body to massive doses of ionizing radiation, as much as 500 chest X-rays in one go, and there is zero evidence that full-body scans without symptoms improve outcomes. What they do is detect tiny nodules or abnormalities that are totally normal in aging bodies, but once they're found, doctors feel compelled to investigate further, leading to biopsies, PET scans, surgeries, and panic. A 2023 study suggested that CT scans now contribute to up to 5% of all cancers in the U.S. That means for every 20 cancers diagnosed, one could have been caused by a scan meant to prevent it. Meet Marcus, an 80-year-old martial arts instructor, who felt great. His full-body scan showed a tiny nodule. He went through a PET scan, a needle biopsy, and wound up with a collapsed lung. The result, benign. The damage? Weeks in the hospital and months of recovery. Experts are united on this. No full-body CT scan should be done in asymptomatic adults. If you have unexplained weight loss, blood in stool, or a lump, then a targeted scan is appropriate. Otherwise, you're scanning for problems that may not exist and putting yourself at real risk. Friends, modern medicine is a gift, but it's not flawless. In seniors, more testing is not always better. Each test has a cost not just financially, but physically and emotionally. If you're over 70, the smarter path is to ask, if this test finds something, what comes next? If the answer is risky, unclear, or fear-based, it may be wiser to say no. Prevention isn't always about scanning and probing, it's about movement, sleep, food, hydration, and emotional well-being. It's about living fully, not fearfully. And if you want a complete roadmap for feeling younger, sharper, and more energetic, don't miss my ebook, Ageless Vitality. It's filled with science-backed tips, anti-inflammatory recipes, balance routines, brain-boosting strategies, and more, all designed with you in mind. You'll find the link pinned in the comments. Let us know in the comments if you or a loved one has ever suffered due to unnecessary testing. We read every story, and your voice matters. Until next time, stay well, stay wise, and choose your checkups with care here on Dr. Alicia's MedTalk.